Hello everyone, now let us discuss about common disorders of digestive system part 2. Now coming to jaundice. Jaundice is a yellowish coloration of sclera, that is whites of the eye, skin and mucous membranes due to buildup of a yellow compound called bilirubin. After bilirubin is formed from the breakdown of the heme pigment in aged red blood cells, it is transported to liver. After the bilirubin is formed from the breakdown of heme pigment, which is a component of RBC, that is nothing but red blood cells, it is transported to liver where it is processed and eventually excreted into bile. And the three main categories of jaundice are prehepatic, hepatic and extrahepatic jaundice. The prehepatic jaundice is due to excessive production of bilirubin. Hepatic jaundice is due to congenital liver disease, cirrhosis of liver or hepatitis. Extrahepatic jaundice is due to blockage of bile drainage by gallstones or cancer of the bowel or the pancreas. And because the liver of a newborn functions poorly for the first week or so, many babies experience a mild form of jaundice called as neonatal jaundice that appears as the liver that disappears as the liver matures. And usually it is treated by exposing the infants to blue light, which converts the bilirubin into substances that kidney can excrete. Now coming to liver function test. Liver function test, LFTs, they are called as LFTs. Liver function tests are blood tests designated to determine the presence of certain chemicals released by liver cells. These include albumin globinase, alanine aminotransferase ALT, aspartate aminotransferase AST, alkaline phosphatase ALP, and gamma glutamyl transpeptidase GGT, and finally bilirubin. The tests are used to evaluate and monitor the liver disease or damage. Common causes of elevated liver enzymes include non-steroidal anti-inflammatory drugs, cholesterol-lowering medications, some antibiotics, alcohol, diabetes, infection such as viral hepatitis and mononucleosis, gallstones, tumors of the liver, excessive use of herbal supplements such as kaya, comfrey, pennyroyal, dandelion root, skullcap and ephedra. Now, next condition is gallstones. If a bile contains either insufficient bile salts or lecithin or excessive cholesterol, the cholesterol may crystallize to form gallstones. As they grow in size and number, the gallstones can cause minimal, intermittent or complete obstruction to the flow of the bile from the gallbladder into the duodenum. And treatment consists of using gallstone dissolving drugs, lithotripsy. The most common form of lithotripsy is shockwave therapy or surgery. For people with history of gallstones or for whom drugs or lithotripsy are not options, cholecystectomy. Cholecyst is nothing but gallstone. Cholecystectomy. Ectomy means surgical removal. So cholecystectomy is the removal of gallbladder and its contents if necessary. Cholecyst means gallbladder. Ectomy means surgical removal. Cholecystectomy is nothing but the removal of gallbladder and its contents if necessary. More than 500,000 of the cholecystectomies are performed each year in the United States. And to prevent the side effects resulting from the loss of gallbladder, patients should make lifestyle and dietary changes which include the following: limiting the intake of saturated fat, avoiding the consumption of alcoholic beverages, eating smaller amounts of food during a meal, and eating 5 to 6 smaller meals per day instead of 2 to 3 larger meals, and taking vitamin and mineral supplements. Next, coming to lactose intolerance. In some people, the absorptive cells of the small intestine fail to produce enough lactase. Lactase is an enzyme. which, as you just learned, is essential for the digestion of lactose. Lactase is essential for the digestion of lactose, and some people don't have enough quantity or amount of lactase. This results in a condition called as lactose intolerance, in which undigested lactose in chyme causes fluid to be retained in the feces, and the bacterial fermentation of the undigested lactose results in the production of gases. The symptoms of lactose intolerance include diarrhea, gas, bloating, and abdominal cramps after consumption of milk and other dairy products. The symptoms can be relatively minor or serious enough to require medical attention. The hydrogen breath test is often used to aid in diagnosing lactose intolerance. Hydrogen breath test. Very little hydrogen can be detected in the breath of normal person, but hydrogen is among the gases produced when undigested lactose in the colon is fermented by bacteria, and the hydrogen is absorbed from the intestine and carried through the bloodstream to the lungs, where it is exhaled. And the persons with lactose intolerance should select a diet that restricts the lactose but not calcium, and take dietary supplements to aid the digestion of lactose. Next, coming to appendicitis. As the name indicates, it is nothing but inflammation of the appendix. It is preceded by obstruction of the lumen of the appendix by chyme, inflammation, a foreign body, a carcinoma of the cecum, stenosis, or kinkin of the organ. Kinkin is nothing but a sharp twist or curve of that particular organ. That can also cause appendicitis. It is characterized by high fever, elevated white blood cell count, and neutrophil count higher than 75%. The infection that follows may result in edema and ischemia and may progress to gangrene and perforation within 24 hours. Typically, appendicitis begins with a referred pain in the umbilical region of the abdomen, followed by anorexia, that is, loss of appetite for food, nausea, and vomiting. After several hours, the pain localizes in the right lower quadrant where appendix is present, RL2, right lower quadrant, and is continuous, dull or severe, and intensified by coughing, sneezing, or body movements. Early appendectomy. Ectomy means nothing but surgical removal. Appendectomy is the removal of the appendix is recommended. Early appendectomy is recommended because it is safer to operate than to risk rupture, peritonitis, and gangrene. Although it requires major abdominal surgery in the past, today appendectomies are usually performed laparoscopically, which is less invasive. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.